afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. And I am joined this afternoon by Governor Janet Mills and Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Governor Mills, Commissioner Lambrew, and I are delighted to be able to be with you this afternoon to provide you an update on where we stand with respect to COVID-19 across the state of Maine for today, Thursday, January 28th, 2021. I'll start off by providing a snapshot of where we stand from a public health and epidemiology perspective, and then turn things over to Governor Mills. I begin my updates on yet another set of sad and somber notes. The Maine CDC has received reports of 5 additional Maine people who have died with COVID-19. The 5 additional deaths reported today include 3 residents of Cumberland County, 1 resident of Franklin County, and 1 individual from Kennebec County. 4 of these individuals were women, 1 was a man. 2 of them were in their 60s, 1 was in their 70s, and 2 were in their 80s. These additional 5 deaths bring the total number of individuals who have died in Maine with COVID-19 to now 567. We'd like to take this opportunity to offer our condolences to all of their friends, families, and community members during this time of grief. Right now in Maine, there are a total of 38,454 cases of COVID-19 that have been diagnosed, an increase of 284 cases since yesterday alone. Of those, 31,064 are confirmed, 7,390 are probable cases. Cumulatively, 1,375 people have been hospitalized, 285 of whom have been hospitalized just in the past 30 days alone. Right now in Maine, 171 people are in the hospital with COVID-19. 51 of those people are in a critical care unit, and 31 of those individuals are on a ventilator. Turning next to outbreaks, there are 2 epidemiological investigations that Maine CDC has opened into outbreaks of COVID-19 that I wanted to take a second to note. The first is at the Crossroads to Calvary Apostolic Church in Morrill in Waldo County, where we are currently aware of 23 cases of COVID-19. The second is at Norway Health and Rehabilitation, where we are aware of 5 cases of COVID-19. As we always do, we will continue to work with these facilities to make sure they have everything they need from a testing, PPE, and infection control perspective to try to reduce the number of subsequent cases of COVID-19 as much as we can. Turning now to testing. For PCR tests, our 7-day PCR positivity rate has now come down to 3.64%. That has been consistent with an increase of testing across the state. Our testing volume for PCR tests now stands at 680 such tests for every 100,000 people. Now, with respect to antigen tests and our positivity rate there, the number there stands at 6.2% on a 7-day rolling average basis. And the testing volume for antigen tests has remained largely stable, now standing at 160 such tests for every 100,000 people. Turning next to vaccines and vaccinations. Let's start with the numbers. As of this morning, there have been 128,704 vaccine doses for COVID-19 that have been administered. Of those, 97,033 are first doses, 31,671 are second doses. Just today, Maine CDC and DHHS have placed our, quote, order, which is to say we have given indications to the federal government about where we want our next week's allocations of vaccine to go. That allocation will be the maximum amount available to us, which is 20,375 first doses of COVID-19 vaccine. This comprises 8,775 doses of the Pfizer vaccine and 11,600 doses of the Moderna vaccine. This represents an increase of 16% compared to what we have received or are receiving this week. We've also learned from our colleagues at the federal level that this level of vaccine allocation to Maine will remain at this level for the subsequent 2 weeks, so 3 weeks in total. Next week, February 1st, the subsequent Monday, February 8th, and then the third one, February 15th. This degree of stability in our dose allocation levels is extremely useful to us as we start working on medium and longer term planning efforts. Being able to know not just what we will get on Monday and Tuesday, but for the subsequent Mondays and Tuesdays for 2 more weeks thereafter is very, very helpful for our planning. But it's also important to note that even though our allocation went up by 16%, in numerical terms, that amounts to 2,800 new first doses. Now, we are extremely thankful for this increase. And with the doses coming in the next week as well as the subsequent weeks, although we are thankful for the increase as well as the stability, it's also important for folks to bear in mind that even with this increase over the next couple of weeks, we will still only receive enough vaccine to vaccinate less than half, only 46% of those Maine people over the age of 70 over the next 3 weeks. Again, we welcome the increase in doses to be sure, and we look forward to subsequent increases. But for now, the supply constraint that we have discussed remains. And finally, about an hour ago, Maine CDC received word from the US CDC that the 4,400 doses of Moderna vaccine that we received last week are in fact viable. This is good news. The distributor and the manufacturer, Moderna, conducted a safety investigation to determine whether the temperature concerns that I had noted compromised either the safety or the efficacy of the vaccine. And the clear answer that we received back was that no, there was no compromising of the safety or the efficacy of these 4,400 doses. As a result, we are working with the entities who received those shipments of vaccine to get those shots into arms as quickly as possible. So with that, I would like to turn things over to Governor Mills.
Thank you, Dr. Shah. As always, an excellent summary of where things stand today in the state of Maine when it comes to COVID-19. Thank you for your assiduous work, day in and day out, for the last more than 10 months now, or actually a year now on this issue. And thank you for keeping everyone so well informed. In mid-November, when we were anticipating a surge in COVID-19, sort of an inevitable surge in cases because of the upcoming holiday gatherings and travel, as much as we tried to put a damper on things, we anticipated a lot more travel, a lot more get-togethers, public and private. We then established a 9 p.m. early closing time for certain businesses across the state. You know, most restaurants, entities that serve liquor and food, whatnot. That early closing time was aimed at reducing the higher risk of COVID-19 transmission that is anticipated with indoor, later hours, indoor entertainment, when people are more likely to lower their guard and not adhere to basic public health and safety measures. That measure, similar to what other states have done, especially New England states, that allowed businesses to keep their doors open, and continuing daytime operations, and continuing curbside pickup and delivery at all hours before and after 9 p.m. And I think that helped. I think it helped us reduce the increase in the transmission of the virus. In a sign of progress, as Dr. Shah has noted, Maine is beginning to round the corner on that post-holiday surge of COVID-19. Today, as he reported, Maine has seen a 7-day PCR positivity rate of 3.64%, which is a decrease from 5.89% on December 31st, almost 4 weeks ago. Maine's 7-day new case rate has declined likewise by 35% in the last 2 weeks. So with the holiday season behind us, and in light of these better figures, these better numbers, We are now prepared to end the 9 p.m. early closing time for businesses effective Monday, February 1st. So starting next Monday, those businesses that had been subject to the requirement may resume late evening operating hours if they choose, while continuing to follow basic public health and safety protocols, continuing those same protocols that they had been adhering to during the daytime hours. The progress we're making is encouraging, but you know the pandemic is far from over. Every time we wear our masks, watch our distance, and avoid gatherings, we help put a lid on this virus and help get our state back on track and back to normal all the faster. We want Maine people to be healthy, of course. It's the highest goal we have and our number one focus. It's not only the right thing, it's the very thing that will bring our economy back too. As so many economists have told me, you can't have a healthy economy if you don't have healthy people. Now, we've been more fortunate than a lot of other states. We've seen people come here, move here, stay here, pay taxes here, enroll kids in school here because they feel safe here. We are safer than many other states. We welcome those newcomers, and we want them to continue living here, working here, and shopping here. So for all kinds of reasons, we've got to keep our state healthy. Right now, we're working to get as many vaccines into the arms of Maine people as quickly and efficiently as possible. A logistical challenge for every state and for our nation. And as of today, as you heard, more than 97,000 people have received doses of vaccine. 31,000 have received their second dose of vaccine. God bless them. But even if you've been vaccinated, as Dr. Shah tells you frequently, it's still important to keep taking those basic measures, those steps that public health experts all over the country tell us will help keep us all healthy. Even if you've been vaccinated twice now, keep sticking to those measures, keeping your distance, wearing a mask, washing your hands, etc., avoiding gatherings. So speaking of staying healthy, I also want to acknowledge that just this afternoon, President Biden announced that his administration is opening a special healthcare enrollment period for marketplace coverage on healthcare.gov from February 15th to May 15th to allow people to shop for better health insurance coverage at affordable prices. I welcome this news and I applaud the president for his decision. You know that the pandemic has thrown into sharp relief how important it is for everybody, all Maine people, to have access to affordable health care so they can see a doctor, receive the care they need, get preventative care and treatment for illnesses, and stay healthy. My administration has been focused since day one of my tenure on making healthcare more affordable and more accessible to Maine people. Right now, for instance, more than 70,000 people have health insurance as a result of Maine Care expansion, which we implemented on day one of my administration. Now, with the open special enrollment period fast approaching, I encourage Maine people who are looking for affordable health coverage to visit coverme.gov from February 15th to May 15th to learn about coverage options, find local assistance in navigating the difficult health insurance environment, and consider applying for better health insurance. It's important that we all have the best coverage possible. So thank you, and I welcome any comments and questions.
Thank you, Governor Mills. The first question for the afternoon goes to Patrick Whittle.
Okay, thank you very much. So there's a story in the Bangor Daily News today regarding the amount of demographic reporting that's available to the state about who is getting the vaccine, wherein they reported that about 40% of people who've received vaccines haven't provided information about race and ethnicity, which I'm assuming must make it kind of difficult to track if underserved communities are getting access to the vaccine. Could you talk a bit about how much of a priority this is for the state and what can be done to sort of make sure that these data are available?
Sure thing, Patrick. Happy to start that off and welcome the governor and the commissioner to weigh in. But that's correct. Well, let me first start by zooming out one click, which is I would urge everyone to take a look at the new COVID-19 vaccine and vaccination dashboard that we've just put up. It has a number of pieces of data on it, including where folks are being vaccinated, which categories they fall into, so on and so forth. And so I'd urge everyone to take a look at that dashboard. As Patrick noted, one of the early findings from that has been that many individuals who have been vaccinated thus far have either declined to provide their racial or ethnic background, or it hasn't been reported up to us by those who are administering the vaccine. I want to take a second to talk about why we collect that information and what we do with it. The reason we collect it is, as Patrick noted, because we want to make sure we know how we're doing on every access of vaccine and vaccination. We want to make sure we are reaching populations that have been disproportionately affected by COVID-19, whether that's because of their race or ethnicity, because of their geography, or because of their age. We can't know where we're going and whether we're getting there unless we know where we are. And having those data helps us get to know where we are so we can chart a course. That's what we do with those data, and that's why it's important. The fact that right now we don't have perfect clarity into that is concerning. We're working with providers as well as talking to Maine people directly to let them know that when you go to get vaccinated, the reason that we ask for your race or ethnicity is to help us make sure that others of that same racial or ethnic background can be vaccinated and that we can make sure we're getting vaccine to them.
And I'll add that as part of our plan to both administer vaccines efficiently and equitably, this week we really are striving to move out to older Mainers who may be racial minorities or live in rural areas or who otherwise may struggle to get to a vaccine clinic. So some of the activities that we're going to undertake in the next week include first sending a letter to 31,000 low-income Mainers to give them information about their eligibility as 70-year-old and older Mainers for vaccines. Second, sending vaccines to some of our federally qualified health centers, including one that's going to be offering a clinic to Somalis who are 70-plus-year-old in the Lewiston area. Third, we're going to be working with our local area agencies on aging who work with homebound seniors and other people who, again, may struggle getting to some of the vaccine clinics that we're setting up. And lastly, we really are going to look at our map to find out where are those places in the state where the percentage of people vaccinated is especially low. So that does include York County, it does include Washington County. We'll be looking at the data that we're developing to identify both people who may, because of their race or ethnicity, be challenged in getting a vaccine, but also people because their economic circumstances or housing circumstances are as well. It will take time though, and I will just say that, as Dr. Shah said, we don't have enough vaccine yet, even in the next month, to get to even half of all people ages 70 and older, but we will work to do so quickly as well as equitably.
Okay, thank you very much for that.
Thanks, Patrick. I'm going to turn next to Ashley Blackford at WAGM.
Hi, Dr. Shah. So we're hearing from some residents here in Aroostook County who are concerned they're not going to be able to get vaccinated because people from other areas in the state are coming up here. I'm wondering, are there any plans in the works to monitor that? I know last time we chatted, you reminded people that they need to get their second dose in the same location as their first. That doesn't seem to be deterring people from traveling up here, and a lot of residents we've heard from are quite worried.
Yep, Ashley, this concern has been brought to our attention as well. Right now, I think the way that we can best approach that issue is to try to make vaccines and vaccination available across the state. So that someone from Sanford doesn't have to drive all the way to Fort Kent, for example, or there's not a reason for them to do so. Because that's hardly efficient, and of course, it'd be better if someone could get vaccinated closer to home. So our approach right now is to remedy this concern by trying to offer vaccines and vaccinations closer to where folks are, so that that sort of cross-county travel doesn't need to be something that happens. That's why, as the commissioner just noted, we're starting to roll out on getting vaccine into federally qualified health centers. which have wide coverage across the state, working with hospitals across the state to offer more clinics, things of that nature. That's what we think is the best way to address that cross-county travel. I'm going to turn it over to Chris Costa at News Center next.
Hi, Dr. Shah. Can we just, if you don't mind, starting about the increased doses of vaccine? Obviously, as we've heard from some of the hospital systems, when we are using more vaccine, like we would at a mass vaccination site, we're able to then request more as a state because it's getting into people's arms. Can you kind of explain this cycle and if there are going to be more mass sites popped up because we have the increase to vaccine?
Sure, Chris. I want to start by, I don't know that you were suggesting this or not, but for perfect clarity, I just want to start by discussing how allocations of vaccine are made to states. The Biden administration, as recently as yesterday, has reaffirmed that they will be sticking with the population-based allocation. That is to say, the vaccine that gets allocated to each state will be based on their census numbers, the number of permanent residents that they've got there, not based on what the outgoing or the former administration had said, which is the speed with which states were using doses, but rather sticking with the per capita pro rata distribution. As a result of that, what matters still though is throughput. If doses are coming in, if 20,000 doses are coming into the state, we want to make sure that in the 7 days in which we get them, we are using as much of them as we can, because the more shots into arms we get, that's going to be the fastest way to start bringing down case numbers. So throughput remains the imperative, but it's not because we are angling to get more vaccine. It's because we want to get folks vaccinated for their safety.
Maybe I could add, I think, because I was on a call a couple of weeks ago under the previous administration where it was suggested, in fact, Secretary Azar said that they were going to pump more vaccines out the door and diminish the reserves. 2 days later, we learned there really weren't any reserves. But at the same time, he also said that they were going to start sending more vaccines to states that had the best records of vaccinating people, getting shots in arms. That really didn't happen. And on my calls with the new administration, they've confirmed they're not trying to engender a race to the finish line here, that everyone should be treated equally based on population. Obviously, they want, and we want, everybody to get vaccinated as quickly as possible. That's our goal. But there won't be a rationing of vaccine depending on how well you're doing getting shots in arms.
Let me turn it over to Morgan from WABI next.
Hi, Dr. Shah and everyone. Thank you for taking my questions today. My first question is about the vaccine process. Dr. Shah, is there advice that you have for people when they go to a community center or they go to a clinic to get their vaccine, whether it be, when they're waiting outside, when it comes to masks, and then the aftermath of the vaccine, should they take time off from work, etc.?
Sure, Morgan. Let me offer one thing on each. The first is, two things on the first, which is when you go to get your vaccine, whether it's at a large scale site or at a local hospital or perhaps at an FQHC starting sometime next week. I would ask everyone to bear two things in mind. The first is to please be patient. Large scale vaccination is still something that is rolling out across the country. And there may be a delay. There may be a snag in the system. You may think that it will only take 5 or 10 minutes. It may take 10 or 20. So I would ask everyone for their patience. An effort of this scale and scope and magnitude has not been undertaken in a generation, if not longer. So please be patient as you work your way through that process. The second is to remember that even though the vaccine and vaccination heralds the potential new beginning of getting back to normal, the process itself of being vaccinated is still one where we want to make sure you're not getting infected. So even though you may be going to get a vaccine, you still got to be physically distanced. You don't want to crowd in. And those things like wearing a face covering, those persist even after you've been vaccinated. Speaking of after you've been vaccinated, unless you are feeling particularly crummy the day after, there's no reason to plan to take time off of work. If you wake up the next morning and you don't feel like you can go in because you've got a fever, then that's one thing. But for the most part, virtually everyone who's been vaccinated thus far has felt some mild site pain at the site of injection, and that's about it. According to the CDC, that little pain in your arm is the overwhelming most common side effect. That's not even a side effect, that's just an effect. So there's nothing special that folks need to do after they've been vaccinated.
One more thing is they'll give you this little white card, and I urge people to keep the white card or even take a picture of the white card on your cell phone. So if you lose it, you have a picture of it.
Thank you. And one question about masks. Should people double mask? Should people be wearing N95s? Now we're seeing different things coming out about reports about masks. Your suggestions on the best practices with that?
Sure. Let me start, Morgan, on the N95 piece. And unless you are a healthcare worker and unless you have gone through the fit testing process, there is no need to wear an N95 mask. Indeed, it is best to reserve and preserve those masks for frontline healthcare workers who have gone through the fit testing process so that they can make maximal use of the N95. If you haven't gone through that process, putting on an N95 that you got online or from somebody does not confer any additional benefit, and it only takes it away from a healthcare worker who can make maximum use of it. But wearing two masks is something that's certainly been in the news lately. Dr. Fauci himself was asked about this just a few days ago. I think his exact words were that it made good sense or that it was common sense. Here we are in a time when wearing two masks may be a thing. I think of this in the way that I think of so many things, especially in cold weather, which is layering. Layering is something that we are all used to and well aware of in cold times. Wearing two masks is in that same category. Does it help? It could. It certainly could. The open question is, what's the magnitude of the benefit? Is it 10 times better? Is it 5% better? No one's really sure about that. What I would recommend is that if you are going out, if you're going grocery shopping or something like that, and you want an extra measure of protection, wearing two masks is something that you can do. It's not difficult to do. All I would ask is that if you're doing so, make sure that the two masks aren't interfering with each other and that you still have a tight seal around your nose and mouth.
Thank you.
Let me turn it over to Amy Brown next.
Thank you, Dr. Shah. Regarding the outbreak at the Crossroads to Calvary Church in Morrill, is it known if the congregation had been following safety guidelines prior to the outbreak? And are all of the cases primary cases, or have there been secondary cases? And also, have there been any deaths associated with the outbreak?
Let me take those in order, Amy. As to the former question, that's one of the things that our outbreak investigator, as they work on any type of outbreak, no matter if it's at a house of worship or anywhere else, one of the questions they try to ascertain is what was the percentage of folks who were wearing face coverings and maintaining physical distance. We've just started that investigation right now, so I don't have the answer for you there. Similarly, with respect to primary versus secondary cases, that investigation is just getting underway. So I don't have a sense right now of how many of those were initially at the site of the outbreak versus follow-on. And as of right now, there haven't been any deaths associated with it.
Great, thank you. And a question from a listener who's wondering if as more information is becoming available, as more people get vaccinated, if it's been narrowed down, who might be predisposed to having an adverse reaction to the vaccine, if there are specific types of allergies. I think you mentioned a while back that perhaps shellfish allergies might predispose. No? Okay. But is it known what types of allergies people have had in the past that might make them more predisposed to having a reaction to the COVID vaccines?
So the bottom line here, and the science on this continues to evolve. Based on a briefing call that I had the opportunity to join on Tuesday evening, the latest is essentially if you are someone who has allergies to a wide array of things, be it food or medicine, so not specific point allergies like I'm really allergic to penicillin, but rather you are someone who is allergic to a lot of things, whether it's multiple different types of drugs, multiple different categories of foods, you might be at a slightly higher risk. But even there, based on the briefing I was on, there are legions of folks who have multiple allergies to different categories of things who have been vaccinated with either the Pfizer or Moderna product and suffered zero allergies whatsoever. So there isn't a fine line that can be drawn between if you've got this, you will definitely have a reaction. That's why, for example, for folks who have had a history of severe reactions in the past, that's not an absolute contraindication to the vaccine. It just means that you might have to be monitored for 15 additional minutes.
How many adverse reactions have there been in Maine?
In Maine, we have logged as of a couple of days ago, about 34 total reactions of all types, whether that's a little bit of pain at the site of injection or an individual who got some hives. It's been of all types.
Great.
And that is now over, over 100,000 doses, 128,000 doses that have been administered.
Great, thanks.
Over to Rachel Ohm at the Press Herald.
Hi, Dr. Shah. So I have two questions. My first question is about the long-term trajectory of the virus. Can you say anything? I know we said earlier that we have some improved health metrics. Are we out of the post-holiday surge, and are things kind of looking better from here, do you think?
Rachel, the way I would describe it is that we are taking a moment of repose. The case numbers have come down, the positivity rate has come down, hospitalization rates remain elevated, but those too could come down given that that is a lagging indicator. Let us hope so. The same can be said of deaths. But at the same time, we know that there are new variants that have been discovered in other parts of the world that are increasingly being found in the United States. A variant, there were two cases of a variant first described from Southern Africa that were just reported in South Carolina today. So although things are somewhat favorable, and as the governor noted, the post-holiday surge that we thought would happen and did happen may have leveled off a bit, we are still equally concerned about what we see on the horizon unfolding across the globe. I think the bottom line there is that this is not a moment to say that we're done and over with it. It's a moment to make sure we're still doing all those things like keeping face coverings on, avoiding crowds, maintaining physical distance.
Okay, thank you. And my second question has to do with vaccines. If we're prioritizing people who are age 70 and over, those demographics probably look pretty different from the demographics of, say, frontline workers. And I'm just wondering whether that raises any concerns for you that there may be vulnerable people that we're missing, and that there may be equity concerns with prioritizing those older people first.
Well,
sure, Governor, please.
Yeah, we're not skipping anybody. Everybody will be eligible to be vaccinated. We just don't have enough vaccine to vaccinate everybody right now. And obviously we made a difficult decision, but the decision was to identify those people, frankly, who would suffer and die if they didn't get the vaccine. Who is most likely to suffer and die even without the vaccine? And clearly from the US CDC, the ACIP, and our experts, the answer was people 70 and above. Would we rather do a broader category? Would we rather now include all kinds of people with underlying morbidities or conditions, health conditions? Of course. Would we like to include teachers and truck drivers and all kinds of people? Now, yeah, we'd love to do that now, but we don't have enough vaccine. There's about 193,000 people, if I remember correctly, in Maine who are 70 and above. That's a significant number and a significant portion of our population. I think 22% of our population are over 65 or 65 and above. So we have an older population. We have a very dispersed population, a very vulnerable population of all ages. So that's where we're focusing. We're doing the healthcare workers because that's like getting on an airplane, being told, put your mask on before you try to help others. They are the front lines of addressing this pandemic and taking care of all of us with health needs. And then we're doing people 70 and above and some frontline workers who are both exposed and more apt to transmit the virus. So we're doing what we can as fast as we can.
Thanks, Rachel. I'm going to turn it over to Allison Ross next.
Hi, Dr. Shah and Governor Mills. Thanks so much for taking my question. So a few questions here. About 3/4 of people who have gotten their second dose of the vaccine in Maine have been women. So what factors are leading to far more women being vaccinated than men?
You know, I'll start, and I think, but again, I invite others. I think it has to do with the composition of the healthcare workforce. The healthcare workforce in Maine and across the country has a high percentage of women in it. And given that we focused our group 1A on healthcare workers, those who are working in all different types of patient care settings, I think what you're seeing is an effect of that decision, which again has the benefit of making sure that all folks are vaccinated. But in this case, it means that a high percentage of women are vaccinated.
Great. And when Mainers see that just over 2% of people in the state have been vaccinated so far, what should they make of the work that's still ahead on speeding up this vaccine process?
You know, I'll start there, but again, welcome others. You know, it's a long road. It's going to be a long road. We have already come down a very long road, and now we have another one ahead of us. It's going to take time. And so the one thing I would ask, and everyone who's watching, is to continue to bear with us. We are hoping that as more vaccine starts to become available, you'll see those numbers tick up. Vaccines will be more available, but it will continue to take time.
And my final question here, how high of a priority are teachers?
Teachers are a priority. They're not in the first category because we just couldn't do them in the first category. We don't have the numbers. Let's remember, let's go back a month or two, because this has just started about a little over a month ago, this vaccination process, when these two vaccines were approved with an emergency use authorization, kind of rushed through the FDA, obviously validated, certified, approved. And one of those vaccines is required to be kept at super cold temperatures. So the first challenge was, who's got ultra cold freezers? Where can we store this vaccine? And then it comes in cases of 975 doses. You can't just open up one case and dole out a few vaccines here and there. So we had to set up the logistics through the healthcare systems first and foremost to distribute those vaccines. And then the other doses, the Moderna, come in cases of 100. And again, you can't just deliver a few doses here or there. Maine has a very dispersed population, the most dispersed population of any state in the country. So gathering people together and finding the most efficient way to disperse these new vaccines has been a real big challenge. And I think we're doing as well as we can with those challenges. And then not having consistent, stable supply from the federal government, and inconsistent numbers, expecting to get 18,000 when you get 17,000 one week or the other. That has been a real problem in being able to line up, pre-register people for those appointments to get vaccines. The worst thing to happen is to have somebody anticipate getting a vaccine, show up for an appointment, and then the vaccines are out. We don't have enough. That's what we've been trying to avoid more than anything. So keep in mind the logistics, the terrific hurdles that we and all the other states have been facing these last 5 weeks in particular. You know, we're getting there, and we will get there with everybody's help.
So just a quick follow-up, they're not in a particular phase just yet?
Well, I'm sorry, teachers in particular?
Teachers, yes.
No, we're trying to get through the healthcare workers, the frontline people, and the people 70 and over. That's going to take a number of weeks yet. Right.
Great, thank you.
Thanks, Allison. Let me turn it over to Steve Betts now.
Hi, Dr. Shah. This question may seem a little early, but I know the organizers of summer festivals are well into their planning stages. What's the thoughts about allowing summer festivals this year?
Crystal ball question, Steve. Let's wait and see. That's the best I can tell you right now.
It's not only how well we're doing getting people vaccinated, but on average, we see another 20 million people coming into the state of Maine at the height of tourist season in July and August. So decisions depend on how well those other states are doing too. Will the Canadian border closure be lifted? Will New Brunswick and Quebec allow people to come back and forth? And will the national government allow people to go back and forth? A lot of that, and will they be vaccinated? So much depends on so many other things. We can't say, yeah, on July 1, the curtain's going to be lifted and we're all going to have fun again and go to festivals. Would that it were so, but there's so many factors.
Thank you.
Let me turn it over to Jessica Piper now.
Thank you, Dr. Shah. First, I wanted to ask a quick question about the 4,400 vaccines that you mentioned. Are those now like bonus vaccinations that Maine has since they were replaced earlier, or is Maine going to get like fewer vaccinations in a future shipment because we can use those?
Very good question, Jessica. That is under discussion right now with the US CDC and Operation Warp Speed.
Okay. And then Commissioner Lambrew had mentioned a clinic in the Lewiston area specifically aiming at vaccinating seniors in the Somali community. I was wondering what else you might be able to say about that, when it might open, that sort of thing.
So we're still working through the details because part of the success of that type of clinic is really letting the community itself help us organize it. So I know that St. Mary's, the B Street Clinic in Lewiston are working with our team and some of the local communities who are organized by this community or run by them to try to figure out how quickly they can identify that population and set up the clinic to get them vaccinated. So details are to come, but that is one of many that we hope that are going to be targeted specific efforts to go to where older Mainers are, especially those that are hard to reach. We know that we've already begun to see some of these clinics, for example, being set up at different senior housing authority projects throughout the state of Maine. We hope to be creative and innovative and listen to our communities to find out where are those seniors who have challenges getting to vaccines so we can go to them.
Jessica, I want to go back to your first question. I'm sure it was obvious, but I just want to be really clear. Our position with respect to those 4,400 doses of Moderna is that whatever temperature excursion occurred, thankfully, they did not compromise the safety and efficacy, but that had nothing to do with the state of Maine. That was something that occurred during transit. And our position is thus that those 4,000 doses, 4,400, should not be debited against or decremented from future allocations, but rather should be kept in the state and utilized because of the questions around them. Again, that's under discussion right now, and when we have a final answer, we'll let you know.
All right, thanks.
Over to Evan Popp next.
Hi, Dr. Shah, thank you. This question is for Governor Mills. Governor, in directing your administration to attempt to find $100 million in federal funding to allow the state to forgive taxes on PPP income, is it your understanding that there's some federal funding that can be used specifically for that purpose? Or would that 100 million be coming from money that could be spent on other needs that may be more essential to COVID recovery than additional tax breaks for grants that are already tax deductible if they're used for business expenses?
Thanks, Evan. No, well, I don't propose borrowing or stealing the money from other legitimate expenditures like general purpose aid to education or buttressing the CDC and our public health, again, rebuilding our public health infrastructure, which was such a major concern of ours the first year of my administration, and still a big concern, obviously. No, we're not going to be borrowing from people to pay Paul. I've asked all my department heads to dig deep and look for other sources of funding, basically federal funding, first and foremost. This is a problem that occurred or came to the forefront really on December 28th. You remember the last week of congressional debate on the most recent relief plan. There was a lot of debate about whether or not to give the states and local governments any money at all. Vigorous debate. And the final analysis was that bill contained a provision that finalized the deductibility of those expenses that businesses have and made it official that they would not be taxed as well. At the same time, they offered up no funds for states and local governments for any sort. So I'm very sympathetic with small businesses who use that money, the generosity of the federal government, use that money to keep people on payroll, to keep people off the unemployment rolls, to keep the lights on and their doors open in a time of extraordinary financial distress. Many of those businesses, especially the small businesses, have real serious challenges still, financial challenges. I don't want to double burden them. We've talked about the double benefit of allowing, of saying that's not taxable, but also allowing deductions. I don't want to double burden them with saying, okay, now you got to find money somewhere to pay taxes on that income. So it's a tough issue, but you know, it's like a lot of tough issues where we acknowledge a problem and we're going to solve the problem. We've presented the problem to the Taxation Committee and the Appropriations Committee. We'll be working with them and working with our departments to solve the problem. That's what we do.
And just quick follow up on that. You know, what's kind of the plan if that federal funding is not really able to be found that can be specifically used for that purpose, and that wouldn't take away from some of the other things that you're trying to do?
I'm not going to be that pessimistic, Evan. Things are happening day by day. The federal government and the new federal administration has already made some changes. You know, how many executive orders did he issue? And Congress is well aware of the problem. Every state's seeing this problem. Some states, like 10 or 12 states, have actually said you can not deduct, you can't deduct the expenses paid for with that money. That seems like a logistical nightmare too. Some states have said you can have both deductibility and non-taxability. Some have said it's all taxable. But so every state is seeing this problem, and it's a question of revenues. We're not going to give up today or tomorrow. We're going to find a solution, and I'm optimistic that we will, because that's what we do, is solve problems.
Thank you.
Going to turn it now to Greg Lagerquist.
Thanks, Dr. Shah. Good afternoon, Governor and Commissioner Lambrew. Sort of a follow-up on some of the questions that have already been asked here. And I know the state obviously has no control over when these vaccines arrived. You're merely a conduit for information. But as we see the numbers you're talking about today, people who are 70 and older, how long that's being pushed out, maybe into March before you get to all those folks, should people reasonably infer, if you're at the back of the line, you're 40 years old, no underlying health conditions, you're not a frontline worker, that if you had, maybe you were hoping that you could be getting a vaccine in the spring, that's being pushed out, that it's going to be maybe late summer. Again, how fine a point can you put on that, and what sort of reasonable expectations can you give people at this point about when they could be seeing a vaccine if they're not a priority person at all?
Well, sorry, Governor, go ahead. And you're on mute.
Yeah, I was just going to say, look, all the more reason for all of us to take every precaution. Can't let down our guard. You're not going to know who's been vaccinated, who hasn't been vaccinated when you're walking down the street or when you go to a restaurant or go to a gathering. You're not going to know. And it's just all the more important to keep up the precautions. I wish we had a timeline. I wish we had like a thermometer like the United Way has. We've gotten this far, but we don't have those gauges. President Biden has assured us that he's going to put out another 200 million doses in the next few weeks or months. That's optimistic, and we welcome that news. We expect to get our pro rata share as it's produced. So I wish we could all be more definitive about when, what day, what hour each person in Maine will be able to get a vaccination. We can't do that at this time, but we expect and request everybody's patience.
Thanks, Greg. I actually had a quick follow-up, if I may, as well. And Governor, to you as well. You talked about obviously the rollback of the early closing hours, and we heard Dr. Shah mention a moment ago about the variants that you're watching as well. How fragile is this? If we see a spike, for example, in these variants, or as many health officials fear that these could become the predominant form of COVID that's showing up in our states, how quickly could you pivot and roll back these early, pushing back the openings?
I'm not going to prejudge what public health measures might be the most appropriate to address the spread of an as yet unknown, unseen in Maine, a variant of COVID-19 virus. We'll address that with our national counterparts, the United States CDC and the new CDC director, as well as our own public health experts here in Maine, including Dr. Shah. There's no reason at this point to take any extra public health precautions in anticipation of the spread of that variant.
Thanks, Greg. And to round us out for the afternoon, I will turn things over to Patty White.
Thanks, Dr. Shah. I've got another question about the COVID variants. And I know that Jackson Lab is doing sequencing to find them. Are there any other labs that are doing sequencing? And how long do you think the variant could be in circulation before we're able to identify it?
The latter question is a great question. Hard to speculate, hard to know. But as to the former, Patty, you're right. It's not just Jackson Laboratory. We're also sending samples to the US CDC's laboratory down in Atlanta to do that sequencing. We are also looking and working to bring on that capacity within our laboratory for more urgent samples that need to be tested rather than ones that can be sent in batches to either Jackson or down to Atlanta. So we're working to bring on that capacity for limited numbers on a more urgent basis here in Augusta.
Can you give us an, kind of an amount of how many, how many tests, I guess, you're sequencing, or what level?
Yes.
Yeah.
Yes, I can. Let me pull it up really quickly. I don't want to get it wrong, and so we will get that number for you, Patty. I have a number in my head, but I want to make sure it's correct before, because I know I got a number yesterday at a briefing, and then a little bit later that number was increased because we had just sent a batch. So we will get you that number.
Okay, great. And then once it arrives in Maine, do you expect we're going to need to change our protocols? I mean, I know Governor Mills, you just talked about this in terms of the closings, but I guess I'm wondering, do you think it might mean that we need to have, an official policy on doubling up on masks or staying further apart than 6 feet? I mean, are you expecting that is going to be needed when the variants come to Maine?
It really is too early to tell, Patty. There may be, as Greg's previous question and the governor noted, there may be changes that have to be made. Whether those involve things like restaurant closures and such things, that's one category. Then there's the category that you noted around things like masking policies, physical distancing policies. I will note that in the UK, as well as in other countries that have experienced these variants, they have not, for example, required or mandated double masking as of yet. Again, not clear what there is a benefit, but what the magnitude of that benefit is on top of traditional masking, hard to know, difficult to quantify at this time. So I think it really will depend on what we start to see, the impact that it has, so on and so forth.
Okay, thank you.
Mm-hmm. Governor, before I turn things back over to you, I just wanted to let folks know, earlier in the briefing, I mentioned a brand new COVID-19 vaccine and vaccination dashboard that we just launched, but I did so, and I urged everyone to take a look at it, but I did all of that without actually telling you how you can get there. So you can do a couple of things. The first, and perhaps the easiest, is simply to go to your favorite search engine and type in Maine COVID vaccine dashboard, and that will take you right to it. If you are more of a traditional URL-driven person, the link to it is maine.gov/COVID-19/vaccines/dashboard. And that will take you right there. And I urge everyone to take a look at that so you have a good sense of where we stand with respect to vaccinations across the state. Governor, I'll turn things back over to you, please.
Well, hey, thanks. And I just want to thank you and thank Jeanne Lambrew for participating and doing everything you've been doing for so long to keep us apprised of all public health issues and measures. I know Jeanne was brought up in Maine and she was a star athlete in high school in Southern Maine. I was born and raised in Maine. I was not a star athlete, but some people accuse me of talking like a Mainer. Dr. Shah, we welcomed you when you got here. We welcome you now and every day. We are thankful for you. He's not from Maine. He's from a little town in the Midwest. He came to us from Chicago. But I swear I heard you talking earlier in this briefing, and you talked about the two vaccines. You said Moderna and Pfizer. You said Pfizer. and I want to welcome you to Maine. Thank you.
It's an honor. It is an honor. So, very good. Well, thank you, Governor. I was not a star athlete. I was, according to some people, a star mathlete, however. So with that, Commissioner Lambrew, anything from you to close us out? Very good. Well, thank you all for your time this afternoon. We appreciate you joining and taking some time to hear about where we are. We look forward to talking with everyone again next Tuesday. In the meantime, as always, please be kind, take care of one another. We'll see everyone soon.